right now we'll be moving into our main topic for today, which is diabetes. So we will start with, we have a lot of questions, so many questions about diabetes. Oh my God. So Doc, are we ready?
Yeah.
And so many people are really waiting to hear about diabetes, because there are so many cases, especially in Africa, Nigeria. Diabetes, in our Igbo language, we call it oria sugar. I don't know, my grandmom, she used to say obromam. So it does not mean obromam, or no, it's oria sugar. So first, one of our questions is, what is really this diabetes, and why and how does one get diabetes?
Okay.
Dr. Sula.
Diabetes is, there are different types anyway.
Yeah.
And the two most common types will be type 1 and type 2. Okay. The type 1 is, for some reason, the body stops making enough insulin, because what controls the blood sugar is insulin. And for reasons not yet known, the body stops making enough insulin. Therefore, you eat, you do whatever you're doing, the insulin's just trickling in, but it's not enough to maintain the blood sugar. And it gradually keeps rising and rising and rising. And during that journey, when it's rising, you wouldn't know, because most of us will be walking around, we might not even know we have phase 1 of diabetes. Most times it's the phase 2, your presentation. And because the body has been struggling to push out enough insulin for some time, and it's not, and the blood sugar is rising, so what you may notice after a time is somebody who is usually dry day and night starts bedwetting. Okay? Now tell you that you drink a lot. You'll be drinking a lot.
So that's type 1.
Those are the stages. You drink a lot, and because you drink a lot, you pass a lot of urine. Then bedwetting steps in, tiredness. Because what's happening, the glucose in your body is really the energy, that's the source of energy. And most of the pathways in the body utilizes the energy produced from glucose. So you're peeing out a lot of that glucose in your urine. Okay, you're drinking a lot of water, there's a mismatch. You're drinking a lot of water, you're peeing a lot of water. And because you have a lot of glucose in your urine, it draws so much water into the kidneys. And you just drink a pound, drink it's gone, drink it's gone. Then after some time, weight loss. You lose weight, weight loss, tiredness. And I think for most people, what may draw attention, and it usually takes about 3 weeks to 3 months. It takes a while, especially in type 1. It takes a while to present, and the presentation towards the end is weight loss, the drinking and the passing of urine. And then when you start talking about it, the penny will drop, the other things will come in. Does it run in families? To an extent, yes, it does. The type 1 runs in families. Because if in a family, a mother or a father has it, the children will have a nearly 30% chance of one of them having it. But you're not going to know who's going to have it. It's just a bit of bad luck there. Who has it. For twins, if one twin has it, there's a higher risk of the other twin having it. And if a sibling has it, there's a higher risk of the others having it. Okay. In this part of the world, I'm not quite sure what happens in Nigeria, but I think they do some blood tests they send to South Africa. But what actually tells you that this patient has type 1 is when you check for antibodies and they're positive, then that tells you it's type 1. Because there are different types of diabetes.
Is it not this type 1, type 2? There are others.
There are others. So the type 1 is antibody positive, and the body is not making enough insulin. The type 2 diabetes, yet again, it runs in family. To a large extent, our sedentary lifestyle contributes to that. If you're big, if you're obese or overweight and not active, you are at high risk of having that. The reason for that is the body is not recognizing the insulin. It's still down to the insulin there. There's enough insulin in type 2, but the body does not recognize the insulin, and that's the problem. So you have, and it's called insulin resistance. It's not recognizing that it's there, and then your blood sugar goes higher and higher and higher and higher. I mean, going into the minutiae of what's causing that, and it's just that story. But it's just that there's a lot of resistance, and it's this sedentary lifestyle and obesity and being big contributes to that. Activity, being active, makes your body a lot more sensitive to insulin. So if one is unfortunate actually to have type 2, and you are determined to increase your activity levels and lose weight, sometimes you can revert it. You can reverse it totally. You can reverse it. It's a tall order, it's doable, and if you can do it, then you save yourself a lot of problems. Because the thing with type 2 is that most times before you know it's there, you've already invested in complications. Whereas type 1 is a bit more of an accurate presentation. You get it on, you start your insulin and stuff like that. But in type 2, because you don't know, and we are kind of funny in our lifestyle and carbohydrate as you're talking now, you have a big mold of it in the morning, have another one in the afternoon, then add stout to take it home, and the driver takes you from here to there. So all those things contribute to diabetes. That's the type 2. Increasingly, there's a type, and the type 2 is antibody negative. There are no antibodies. And when you dip the urine, which is another thing, when you dip the urine will be positive for glucose, but not positive for ketones. Type 1 will be positive for ketones and glucose. Okay. Then you have the minutia. There are other types of diabetes. It's not a type 1, it's not a type 2, but the body does not regulate glucose. The body does not regulate glucose. In anything that is diabetes, be it type 1, be it type 2, be it type whatever it is, there are specific first things you do in terms of trying to control the glucose levels. But ultimately and eventually, most will end up on insulin. Most will end up on insulin alongside lifestyle changes. So those are the two main types.
Because these are the main two types.
There is the gestational diabetes
In pregnancy.
where ladies during pregnancy only,
I think,
their blood sugar goes within the diabetic range, but once they've given birth, it drops again. So some people are like that, and if you've had it in one pregnancy, then you're more likely to get it in other pregnancies. And then you have the drug-induced, where some medications you treat other conditions end up causing diabetes. Yeah, so there are still other types.
Steroids in particular.
Wow. Now, why do they take that steroid? Is it a type of
You have a
It
problem.
depends on, say for example, Dr. Osler mentioned earlier, somebody with adrenal insufficiency. You need the steroid because your body is not producing that steroid, and you need that steroid as part of your metabolism. Then that's the only way to manage it. You've got to take the steroid, but as a side effect, that's where you have to balance the risk and benefit with whatever you do. So you need that steroid, your body can't go without, but that is something you've got to sacrifice. But then you can be more careful. You can help yourself by eating healthily, maintaining a very decent weight, being very active to reduce that risk of developing that complication. Not everybody develops it, but yes, it can happen.
Wow.
And there's another rare one that you have in newborn babies, okay, the neonatal diabetes. And this is perhaps for professionals as well to be aware of it. Really for the general public, not to go down the path of this child is on a Wednesday or a Musu and that kind of a thing. Newborn babies can have gestational diabetes. Okay, so for anybody managing a baby, in particular in the first 6 months of life, and you're just having this child that is irritable and the nappy literally is full all the time and feeding endlessly and stuff like that, running a simple check on the blood sugar would help. Luckily, in the southern part of, is it Bristol, this guy is in Exeter, they do run this free service across the world, really. Looking, because they're trying to do the genetic studies for neonatal diabetes, and they do run a service. If you go online and tap for Exeter, the lab in Exeter, and communicate with them, they'll happily arrange, if you're suspecting that in a child less than 6 months, arrange for you to send the child's blood sample to be sent to Exeter for analysis. And if it's confirmed to be, they'll guide you on what the treatment is. Nature tends to be fair sometimes on people, because some cases of neonatal diabetes, the first 6 months is traumatic, but some may end up being transient. A few would also be permanent, that the child will need insulin. And it's one of those very difficult, tricky things. You can imagine a baby trying to control their blood sugar. You need a pot of luck, so we'll get it right. But at least people, professionals should be aware of it, that you have the neonatal diabetes.
Wow. So in this case, which one is more risky, like type 1 or type 2?
None is good.
Yeah, it's good. The end stage is equally the same. End organ damage to the back of the eyes leading to blindness, damage to the kidneys leading to kidney failure. So both are all the same. It just, the difference is how they present. So the type 1 would, generally speaking, tend to be more in teenagers who develop the symptoms. Or some adults, few adults for some reason, develop type 1 instead of type 2. So yeah, it's not the type, it's really
it's how you manage it
and what you try to prevent.
It's how you manage it.
Because sometimes in Africa, like I know of someone who always said that my sugar level is high, I'm controlling it. So does it mean that when that person's sugar level is high, it means that that person is diabetic?
No.
Well, there is a range, it's not automatic. So there is your normal range, there is your pre-diabetic range, and then there is your diabetic range. So, and it all depends where that person is. So if it's the pre-diabetes range, there is really a lot can be done to reverse it. And if it's well within the diabetic range, then it depends on that person. What are you starting off with? Are you obese? How is your diet? How is your exercise level? What other medications are you on? We may be able to change things. Lifestyle changes, like we talked about in high blood pressure, lifestyle changes could help either revert it, depending on how far into the diabetic range, or reduce it to the point where you may need medication, but instead of 2, you may get away with just 1 treatment. So it's, yeah.
Okay. So there is something called borderline in diabetes.
Yeah,
so
that is the pre-diabetes. Yeah, so that's the in-between. It's not normal, but it's not fully in the diabetic range, which then if you do your lifestyle changes, you're very, very likely to revert it.
Okay.
Yeah.
And wow. My uncle always told that when he finds out that his sugar level is high, he normally does this dry fasting. What does that mean? Dry fasting. Because sometimes
in all honesty, having diabetes, you're not strictly speaking supposed to change your lifestyle quite significantly, like the dry fasting. We had earlier mentioned a little bit of everything. Is good for you, but not a lot of it. Okay. If you are confirmed to be diabetic, or even if in the pre-diabetes phase, It's all lifestyle changes and exercise, because exercise increases your body's sensitivity to insulin, and that's the key. Because if the insulin is sensitive, then it's able to take care of the carbohydrate in your food. If we sit and don't do a lot of exercise, we have gallons of insulin, but our body is not recognizing it. And that is what, over time, you begin to present as diabetes and become symptomatic from that point. So, but once you meet the ranges for diabetes, it is a consistent, not when it is high, I fast. No. Those lifestyle adaptations has to be consistent, because that's what's going to give you the benefit. Because what you're doing is like chasing medicine after death. You're already there. It's high today. Maybe it's hitting, in Nigeria they use milligrams per liter, and I think 11 is 200. My mathematics might be wrong. It's 11 times 18, but I think it's 200. That if you're 200, you're diabetic until proved otherwise. In particular, if it's more than 2 hours after you've had something to eat. So if you have a BG of 200, then you are. We run a program at home, and all we do is just BP monitoring and BG check. And for BG check, one of the recent times, you just meet, you have somebody that walked in because it's a free service, and the blood sugar is 333. It's a good going diabetes, no two ways about it. And then she turns around and she says she has no money. She can't go to the hospital. What do you do there? I mean, I can understand there are difficulties at home. Giving that advice on lifestyle at that level is not enough. Because if you're having values, let's say, and that will fall within the pre-diabetes phase, please check this out, because we run here in millimoles per liter, and I know back home you do milligrams, and 1 millimole is 18 milligrams, so you check it out yourself. But I know 200 is 11. Okay, so 200 is 11 millimoles. So if you're having anything between 7 and 11, that's impaired glucose tolerance. And that's when your lifestyle will become of benefit to you, because you're still in the impaired range, and that's why, not a massive mold, but carbohydrate, fiber. You don't have to eat a whole turkey yourself, but a bit of that, a lot of exercise. Getting towards weight loss is of huge benefit. But in the diabetic range, you have to be consistent in what you do, including your treatment. There's no do it for 1 month, don't do it for 2 weeks. It has to be consistent.
It has to be consistent, because again, you're thinking you're fasting. So when you're dry fasting, what is your body doing? Your body still needs energy. You need energy to breathe. You need energy to talk. And if the body can't find it from glucose, what happens? The body starts breaking down the fat, and then you end up with ketones in your blood, in your urine. So that equally will cause harm to your kidneys. So it's a chronic condition. That's something that we forget back home. There is no such thing as chronic. But unfortunately, once you're diagnosed with diabetes, high blood pressure, those conditions tend to be lifelong. So whatever you do to manage it, it's something that can be sustained, something sustainable. You can't just dry fast 1 or 2 days and then relax and expect everything to be okay. It won't work that way.
Because some of them say that when they do that dry fast, or what is called, then the sugar level will come
temporarily
down.
that's
Yeah,
a fake, that's false security. Then tomorrow you eat and everything is back to normal. Because bear in mind, this is more likely type 2 diabetes we're talking about. So the insulin is there, but the tissues aren't responding to it. So you may well fast today and be okay, because the body doesn't have much work to do. So probably you've not added more sugar to what is already there. And then tomorrow you eat, you're adding more sugar by your carbohydrates, then of course the body will come a time when it can't cope anymore.
This is really, and it's just lifestyle, to be honest. That's the key. Lifestyle, more exercise, and eat healthy food. Wow, there are a lot of things.
There's a lot to it. There's a lot.
There's a lot.
You forget again, there's a handful of people, particularly the type 2, because their body is not responding to the insulin anymore, then you do need something to stimulate. So you've done your bit by eating healthily, exercising, losing weight, but then body still needs a little bit of a helping hand. So that's where you need the medication to then still wake the tissues up so that they can then respond to the insulin that is available.
Oh my God.
Or the body have finally given up not producing the insulin anymore. Then you do need to artificially have that insulin. So there is still a lot to it. Yes.
I know these are people who like unkobi.
Yeah, you can still have your unkobi, but moderation.
That's the key. Nobody says stop drinking totally, but only in moderation.
Moderation. Yes. You've had it, moderation. Like, what is diabetic coma?
Diabetic coma.
Yeah, diabetic coma.
That's
diabetic
disaster, isn't it?
Yeah, good.
Well, we talked about the diabetes where you then need treatment. Yeah, where then the person, you've got that much insulin around and the body is not responding, and of course the body have got to find a source of energy that does not rely on insulin. Then you go into the other pathway where the body is using up fat, and of course that fat, the byproduct of it is quite high on energy demand. So there comes to a point where the body cannot maintain that fine balance. The person becomes unwell, start feeling unwell, tired, sweaty, hot, heart is pounding, weakness. That tiredness and weakness continues until the person loses consciousness. And if treatment is not given, this is your...
No, it doesn't.
Or the another pathway where the person has taken too much insulin, where it drops the blood sugar too much to the point again you've not got enough fuel going to the brain. So there's two pathway of it, either one because of too low insulin or where there is too much glucose in the body.
Okay. In Italian language, we say glycemia, hyperglycemia, and
Hyperglycemia.
Okay, so
Hypo and hyper.
So which one is it? The hypo that leads to that coma, or both?
Both. The hypoglycemia will lead to it faster compared to the hyper, because that's your earlier the DKA. That takes a longer period, but eventually it will still lead to that because the body cannot continue to maintain that regulation.
Wow. So what are the best medical intervention for this diabetic coma?
It depends on the treatment. Okay, because one thing, and this is for professionals as well, is to explain to the patients the treatment you give them, which ones can cause hypoglycemia. Okay, metformin, which is a staple for diabetes management, luckily does not cause hypoglycemia. But nearly not every other thing we use does cause hypoglycemia. And for hypoglycemia treatment, there are people they are of the mindset that if you have diabetes, you shouldn't have anything sugary. Strictly speaking, yes. However, if you are at risk of having hypoglycemia, I know you have all these glucotabs, which are 4-gram glucose tablets in Nigeria. I appreciate the issue you can have with ants as well, but you should have it with you all the time. The sun's out. It's harsh in Nigeria. It makes you more sensitive to insulin, and you're likely going to have hypoglycemia. For those who do a lot of working, going to the market, doing this, doing that, you're using energy doing that, you stand the risk of going hypoglycemic. Therefore, I think it's empowering people and letting them understand the signs of hypoglycemia. And what you will notice is that kind of a bit headachy, you don't feel right, a bit sweaty, a bit shaky. Those are just symptoms telling you that your body is being depleted of glucose. And if you leave that, the glucose levels will keep dropping. It will keep dropping, it will keep dropping till the brain cells itself is depleted of its own glucose as well, and that's your coma. So there's a journey to that. It's just being aware of that journey and intervene. Not necessarily go to hospital, because I heard one time somebody that has had diabetes for so long and he was kept in hospital for 1 week because he had a hypoglycemic event at home. I was so excited about it. There was no need to keep it there and then load you up with glucose. So you go from hypoglycemia to hyperglycemia in the so-called management, whereas all you need is Coke.
When that person is hypo.
Because treating that, that's all, be aware of the signs of hypoglycemia. And they are shakiness, you're just shaky. I know it's hot back home, so no two ways about that. But when I meant sweating, I mean it's pouring. It's pouring. You feel quite lightheaded, you're just shaky. It just don't feel right. If you are on insulin, or on other times, you do a lot of glycosides back home. There's a lot of glycosides back home because once they start your metformin, the next thing is glycoside. Those glycosides cause hypoglycemia. It's a side effect. Metformin not, but the glycosides would. And other treatments you add on for diabetes treatment, not the statins, they do cause hypoglycemia. So it's being aware of those signs of hypoglycemia. I know they sell Coke or whatever all over the place, but please, in those situations, you should have a swing of Coke. The whole bottle, not the big normal Coke.
Not the Diet Coke.
I don't think we have a lot of Diet Coke back home, do we? I don't know, but proper full-blooded Coke, as we know Coke, or Fanta, or Sprite, or Miranda, not the low sugar ones, but the good ones. Not that full bottle, because you push yourself to the other side. Most times, all you need is just 100 mils.
Okay.
That will give you the 12 grams you need. All you just need is 100 mils. And you see that those seizures will abate. But treating that as well, because what the glucose in the drinks will do is to push up your blood glucose levels. You need to lock it in. Even if it's 1 crackers or cabin biscuit.
Okay.
Yeah. Because what you've done is, with the sugar in the drink, it woozes it up. Brings your sugar levels up, but then it will drop. So what you need is, you bring it up, you give the crackers, cabin biscuits, any biscuit, even gala, half a gala.
Okay.
Yeah, half a gala. And what it does, those ones are slow release. So as this is coming down, the slow release is releasing your glucose and stabilizing your blood sugar. So it's a two-pronged treatment. I'm not sure there are many people back home on insulin pumps. It's a two-pronged treatment. What you really need is ooze up 100 mils of Fanta, Coke, whatever it is. I didn't say beer or starter.
No beer, no starter.
It's Fanta. No Sprite. Take 100 mils of it.
No super beer.
I'm not sure how many grams malt contains, but malt is just as good. Then wait a little bit. Usually you wait about 10 minutes for that to kick in. If things would allow us, the ideal thing to do is to recheck your blood sugar levels 10-15 minutes later to be sure it's up. I appreciate the difficulties back home and no two words about it, but you can go with the symptoms, because if those symptoms get better, give yourself about 5-10 minutes, then fill it up with half a gala, 1 cabin biscuit or a cracker, because that is like running your car. You put petrol, so it just dribbles in, and those ones will release your sugar slowly. So there's a lot. We should all be aware of the symptoms of hypoglycemia. This is very important.
But this is too much for our old people in the village. How will they?
If you explain it, they will understand it. I mean, ignorance is not an excuse.
It's explaining it. If you explain it, they will understand. Because I know my mom, bless her, she passed away now. She was diagnosed with type 1. She was diagnosed here. So it was educating here. This is the treatment. This is the side effect. This is how you use it. And you must make sure that your food is there before you do your injection. And this is the signs that you would get to tell you that your blood glucose is dropping. And she managed it very well herself.
Good. This is a situation that you have someone who is learned, because there are some of them in the village.
It's information.
It's
Those
information,
ones,
education.
if you tell them what it is, they grasp it.
Yeah.
But it is just explaining. Because I remember once I went back to Lagos to go and work, and it's all diabetes work. And there's this student, I hope he's still alive, beautiful boy. He was about 18, 19 then, and he's had diabetes for nearly 10 years. And by the time we spoke about diet and what you can do and what you cannot do and stuff like that, I mean, he brought tears to my eyes, because at the end of it, he said, wow,
Been doing this.
information is wisdom. I so love that phrase. Information is wisdom. Because what science is information. Information.
Oh. Ah.